Hello, everyone at Canterbury School. My name is Rachel Mangus, and I'm going to be going through your open enrollment presentation for the 2020-2021 plan year. I hope you find this information helpful. To start off, your open enrollment dates will be February 10th, so starting next Monday, and run for 2 weeks through February 21st. As I step through this enrollment, or through the presentation, you can save any questions for the end. And we can, that's, I believe, what we did last year, and we just answered questions at the very end. So we're very excited. This is our 18th annual iCuba Open Enrollment. We're celebrating 18 years of continued service to private Florida educators like yourself. This is a sample of some of our other member organizations. So thank you very much for being part of iCuba. Here's a little sneak peek of what we're going to review today. On the left-hand side of the screen, we're going to review what's new for the April 2020 plan year. And then on the right side of the screen, we're going to review at a high level just some of the same great benefits that are not changing for the current year. So some of the highlights, we have a low increase in the medical premium. Rally got a little bit of a facelift. We do have an increase to the flexible spending limit. We are going to talk a little bit about dependent verification, and we're giving out another great prize for collecting accurate phone numbers and email addresses. So to start off, we talked to you guys a little bit last year about how iCuba is a self-funded medical plan, which means that iCuba pays all the claims that are processed by the medical, pharmacy, and behavioral health benefit managers. They will actually collect the claims and pay them, and then we pay the bigger bill back to the insurance company. So using the premium dollars that you guys pay from your paycheck, we use that exclusively for your benefit and for the benefit of our members. So the premium dollars are used only for your insurance plans as you use them. The insurance is created by educators for educators. We meet monthly in Orlando, and all the schools come together, and we all get together in a room, and we kind of have a little powwow about how we can make improvements to our plan. And I hope that you see some of those improvements that we've made, especially to Rally this year. We hope that this helps you invest in a long-term culture of well-being so you can be the best version of yourself. And thanks to you, we are pleased to present our members with a very low increase for the 2020-2021 plan year. All right, Glee Rewards powered by Rally, 2020-2021 program enhancements. We heard some noise last year about how the program had kind of fallen flat, but we want to revamp this. So we increased the wellness exams back up to $60. They were previously $25. The biometric screening is also at $40. That was also previously $25. And we've added a few on-site events. So that's up to $70. So you can do 7 on-site events this year instead of just the prior 5. We still have preventive exams in there. The Cuba Cares for a qualified medication change. And then there's coin opportunities for missions and challenges, TalaDoc registration, tobacco attestation, and clinical rewards. We heard some last year about how the coins aren't really worth all that much. You know, what do I do with the coins? But what we found is our members are using them and actually donating them. So members donated more than 4 million coins last year to charities, and we think that that's really cool. New this year for those biometrics, we are introducing a physician results form. So instead of having, really forcing you to get your biometrics done on campus or visit that patient service center for your appointment, specifically for your biometrics, to get that biometrics award, now you can do it directly at your doctor's office. There's no additional finger pricks or blood draws that you'll have to do for the biometrics piece with iCuba. You can just simply do it when you get your regular blood drawn with your physician. So the first step after April 1st, the members will log into the same Quest website where you created your appointment previously. And then right on that home screen where you see number 1, you'll just print out a physician results form. You have to download the form, and it is unique to you as an individual or your spouse. It does have a barcode on it to help identify you as a unique employee or spouse. Step 3 is going to be to complete your annual wellness exam with your physician, including your blood work. With that blood work, your doctor will fill out the bottom portion of the form, circled in red and next to the number 3. And then the final step is either your physician can fax it back to Quest, but we know that the doctor's office is kind of crazy and kind of busy. So we are recommending that the member actually get a copy of the signed form, and you can kind of take the responsibility into your own hands and fax or upload it to the Quest portal on your own. So we're really excited to roll out this plan. I got asked so many times last year, why do I have to get my blood work done again? I just got it done, and in previous years as well. So we are really excited to introduce this new option to our members. Some other Rally reminders: Clinical Rewards is still available for chronic conditions. So if you have one of the conditions that is outlined on the screen here, your homepage may look a little bit different. This is just going to provide some additional educational materials to you each quarter. And if you participate in the educational requirements, then you can earn up to $500 or 500 coins per quarter, and up to 2,000 coins per year. We're also keeping the city challenges and private sweepstakes available. So make sure that you keep completing your survey, entering those missions and those challenges. And we in our home office draw for prizes as well. In addition, every single time that you reach a milestone, you'll be entered through Rally to win a challenge Amazon gift card. So if you're entering in those city challenges, and every 14 days we draw a $50 winner. So we wanted to show you the value of our improvements with Glee Rewards powered by Rally. If you've ever done an enrollment in the iCuba benefits portal, you recognize Emma. So we wanted to step Emma through our Glee Rewards program and show you what she looks like next year at open enrollment. We really anticipate this will be her story. So Emma downloaded the Blue Cross Blue Shield mobile app and was able to locate a Blue Distinction Total Care provider. She got an annual physical at her Blue Distinction Total Care primary care doctor for free, because all visits to those are free, and she earned $60 for that visit. Her primary care submitted the Quest physician results form, earning her an additional $40. So just from that one visit where she got her blood work done, she's already got $100 in her pocket. At work, Emma participated in 5 on-site events totaling $50, and she's really hoping for that 2 more that we added this year. Then during a recent doctor's appointment, Emma was diagnosed as diabetic. She connected with a Blue Cross Blue Shield health coach through the Clinical Rewards program to help control her condition. So she's not only on a better path, she's also earning coins through Clinical Rewards. Next open enrollment, we hope that to date she would have earned $150 in Rally rewards that are redeemable for gift cards in that marketplace, and she's donated 8,000 coins to various Rally charities. This is not bringing into the picture the preventive care services or Cuba Cares that are also available. So a pretty healthy, standard, run-of-the-mill person can easily obtain $150 through the program, which we're really excited about. We wanted to highlight the new flexible spending election. This flexible spending is required each year. So the flexible spending account does go up to $27.50 this year. This is pre-tax dollars that you can set aside out of your paycheck. It is available for immediate use on 4/1/2020, and it can be used for healthcare expenses for you and any eligible dependents. It is subject to the use it or lose it rule, so we just want to make sure that you budget wisely. There's no annual carryover with the healthcare flexible spending account. So if you put $100 in there, just make sure that you use your $100 or your $1,000 or your $27.50, whatever you choose to enter into that account. On the right-hand side of the screen, it's just a review of the HRA and some of the features that come with the HRA account as well. Just a reminder, this money does roll over each year, and after 36 months of continuous employment and participation in a medical plan, the HRA is yours to keep if you should leave. The HRA is only for enrolled members on the medical account. Dependent verification. It's really important that you're covering the dependents that are actually your true dependents. Dependents that are not eligible on the ICUBA plan should be removed during the open enrollment period, and their coverage will terminate as of March 31st, 2020. We know that all of you read the fine print before you click OK at the end of your enrollment, but just in case you missed this paragraph, you are certifying that all dependents that are enrolled in your ICUBA insurance are in fact yours. Be careful when you are enrolling them. Just so you know, who is an eligible dependent: your legally recognized spouse, an approved domestic partner, a natural child, a legally adopted child, stepchild, a child that's required to be covered by a qualified medical child support order, a child with proof of legal guardianship who resides with you, and a foster child. Children are dependents until the end of the calendar year in which they reach age 26. So if you have a child that's turned 26 in January, February, or March of 2020, they can still be enrolled effective April 1st, and we will just send you a notice towards the end of the year that it's time for them to go out and find their own insurance. So just a reminder, they are eligible to the age of 26. So where do you go to do all this stuff? Enrolling in your benefits at icubabenefits.org. During this open enrollment period, as you understand, you are free to update your benefits as you choose for the plan year from April 1st to March 31st of 2021. Your open enrollment elections will remain in place as stipulated by the IRS, big fancy section there, and you can change your elections during the year only if you have a qualified life event within 30 days. So when you log into ICUBA Benefits, you'll just click on Start Your Enrollment at the top, and then through the enrollment, you'll step through it, piece by piece. You'll verify your employee information, that dependent verification in there, and then you can confirm and elect your benefit. Emma is still available. However, she is not required. So if you shut her off at the beginning, you can always ask for her help throughout the enrollment process if you'd like. We are hosting an open enrollment sweepstakes again this year. So if you log in at icubabenefits.org, you enter or make sure, just confirm your personal phone number and your personal email. You finalize the enrollment process, you'll be automatically entered to win. And we will be giving away some prizes at the end of open enrollment. So moving on to our next portion, eliminating barriers to care and improving access. ICUBA strives all the time to improve access to our members. It is important to be an educated healthcare consumer and understand how your plan pays for covered services before you see a healthcare provider. The ICUBA plans are specifically designed to remove the barriers to care by offering plans where the deductible only applies to major services. So we really work hard to make the access extremely easy for you. The first way that we eliminate barriers is with this special single sign-on section at our website. So if you've not been to our website recently and you've forgotten about these single sign-on links, they are there to help you. So right under that rotating banner, under My Carrier Account, there are links to the various insurance carriers. The MasterCard link is there, the Optum prescription, Blue Cross Blue Shield, and Aetna Behavioral Health. So if you've never logged in before, you will have to create a username and password the very first time. But after that, it's just a single click and you're straight into the carrier accounts to do stuff like view your EOBs and look at the plan designs and stuff like that. It's pretty cool. The next way that we break down barriers is by dividing our plans into these unique buckets. On the far left, we have items that are no cost access to you. So visits to Blue Distinction Total Care Primary Care, bone mineral density scans, colonoscopies, immunizations, mammograms, medically necessary preventive services, ultrasounds of the breast. These are just a few things that are at no cost to you and will not be subject to your deductible. All of these on the very far left are $0. Then in the middle column, no deductible for, these are all items that do not apply to your deductible. So they may have a copay or a co-insurance attached to them, but you should never have to reach your deductible for advanced imaging, chiropractic services, maternity visits, physicals, prescription drugs, TalaDoc, urgent care, and all the ones listed in the middle column. To the far right, we have items that are subject to your deductible. So these are the ones that you do have to reach that higher dollar amount before the plan will pay. Stuff like hearing aids, hospital delivery expenses for maternity, and hospital expenses in general. The inpatient rehabilitation, private nursing, prosthetic appliances, and durable medical equipment and x-rays. Stuff like that does apply to the deductible. We want to remind you about Surgery Plus. The Surgery Plus benefits are paired with your medical plan. So if you've elected an IQVIA medical plan, Surgery Plus is kind of an added bonus. This benefit brings top quality surgeons that are licensed, board certified, fellowship trained, and have been screened for malpractice and sanctions and they have empty criminal records. They cover surgeries like knees, hips, shoulders, feet, ankles, wrists, elbows, and some of the ones listed to the lower left-hand corner of the screen. And there is a huge financial incentive to you for using Surgery Plus. If you call and schedule an appointment and seek more information from a care advocate over at Surgery Plus, your deductible and coinsurance are waived for your surgical procedure. So there ends up being no cost to you. If they do ask you to travel to meet with that top quality surgeon, there is a travel benefit that's also included. So they will pay you a per diem for food and also pay for your travel expenses along the way. That care advocate service, they provide a full concierge service. They will locate the best surgeons, help you decide which one that you'd like to go with. Then from there, once you make your surgeon decision, they will schedule your appointments, coordinate records, and just make sure that it's as smooth as process as possible for you. TalaDoc is going to remain in place. This is also a very popular benefit. You can basically take a doctor with you. They have telemedicine and video consultations available anytime, 24/7. So if your doctor is unavailable, you don't have time, you're on vacation or a business trip, or you're at work and you feel a little sinus infection coming on, those are all great times to schedule an appointment with a TalaDoc doctor. The doctor visits with TalaDoc are only a $5 copay, and you can call for various reasons. There's some top diagnoses listed on the screen here, as you can see. They do write prescriptions through the TalaDoc service, but it is only for those minor illnesses like a flu or a sinus problem, ear infection, stuff like that. You cannot get controlled substances or lifestyle drugs through the TalaDoc feature. And we would want you to visit your primary care for those anyway. Cuba Cares Pharmacist Advocate Program. We wanted to ask you a few questions this year. Are you having side effects from any new medications, or were you recently denied at the pharmacy for a prior authorization and you happen to misplace that letter that Optum sent you? Or maybe you were told that you need to try step therapy before you can take a certain medication, or you simply just want to learn how you can save money by switching to a generic. These are all great reasons to call Cuba Cares. The phone number is listed here on the screen, and it is also on the back of your Optum ID card. They are available Monday through Friday from 9 to 5, and they are real pharmacists that really advocate for you, and they have real solutions for whatever your question may be. Just as a reminder, there is a rally incentive for this, for contacting Cuba Cares, but it's not simply for calling. It is only if you're a candidate for qualified medication change. But if you do have one of the questions that are listed on the screen, or any other question that you would normally ask a pharmacist, those are all great reasons to call Cuba Cares. Just a reminder, condition management through Aetna is also still available. So if you're enrolled in the medical plan and you have one of these health or life issues that are listed on the left-hand side of the screen, you can be paired with a coach and a therapist. It's 2 weekly sessions for 8 weeks, totaling 16 sessions. So we've heard that this program is actually very beneficial, and it actually teaches you lifelong lessons. You set goals with both your therapist and your coach, and they just are there to support you and really help you through any of these health or life situations that are listed on the screen. So if you're in one of these situations, maybe even a caregiver taking care of another, we know that elderly family members are really an increasing situation for many of our members. So if you're in one of those situations, please don't hesitate to call Aetna and get this set up. Just a friendly reminder that we do have health management and care consultants available. If you do receive a phone call from Blue Cross, Optum, Cuba Cares, or Aetna, please just give them a minute and talk to them and just see what they're calling about, because the likelihood they've identified you for a chronic condition, and they just want to help you understand your condition better, maybe walk you through some of your doctor's treatment, help you with some referrals or transition of care. They really just want to help you manage that chronic condition. So please just give them a few minutes of your day and just hear them out. Just as a reminder, I know that you guys are all aware, but any primary care visit to a Blue Distinction Total Care provider that's considered family practice, internal medicine, or pediatrician visit are always free. So if you're in the market for a new doctor, when you're in the Blue Cross Blue Shield My Health Toolkit, make sure that you click the Blue Distinction Total Care primary care button, and so the site will automatically filter by that Blue Distinction qualification. And then you know that every doctor's visit, whether it's preventive or a sick visit, will always be free. On the right, we just want to remind you about Care Connected. This is the customer service number located on the back of your ID card. So if you ever have a question, or if you need help with a claim, you need concierge assistance for billing, you need assistance even in finding a Blue Distinction Total Care provider or coaching, the customer service line, or we call them Care Connected, is always available to help you. And again, that number is on the back of your Blue Cross Blue Shield ID card under customer service. We rolled the My Health Toolkit mobile app out last year at open enrollment, and so far it has been nothing but great news. Just as a reminder that the app is still there and available. You can download, once you log in, you can give the app permission to store your ID card straight from the home page. I know that I've been in the doctor's office and I don't have cell phone reception, so it's really nice to be able to pull up my ID card straight from the home page of the app, even if I don't have service on my phone. But if you have an iPhone, you can do it from the Touch ID, and I know that Android also has some pretty cool features as far as security are concerned. But once you get in, you can pretty much do everything from your phone that you can from a computer. You can view your ID card, you can scan recent EOBs, and you can really get that real-time data with the Rally integration. The EAP is here not only for medical plan participants, but everyone that is employed at Canterbury School. So if you are going through any of these situations, whether it's emotional, life, legal, or financial, and a multitude of other reasons, or other examples, the Employee Assistance Program is a really great tool for you. It's like having a personal assistant in your pocket. So even if you need help, finding somebody to mow your lawn, that's so simple. That's something that you can call the EAP for. They will actually do the research for you and find, somebody to come out and do, simple tasks like that for you. Of course, ultimately, you will have to choose the provider and pay for the lawn care, but they actually do the steps to finding it. One of the other cool features that we have with the EAP is the emotional support through the free sessions. So members can can receive up to 6 sessions with a therapist or counselor per issue per year. So that's really important to remember. And this is available for each member of your household. The EAP went digital last year, so this is just a reminder that if you don't want to talk with somebody or like over the phone, or you don't want to meet with somebody, you can text the therapist. So if that's something that you're interested in, you can call Resources for Living for authorization, and then they will walk you through the steps onto how to download the Talkspace app. Talkspace does have a short return. It's not like the instant back and forth that you would get with text messaging a friend or family member. You can expect to hear back from your therapist in 1 working day. There are several mobile apps available to help you break down barriers as well. So if you do not already have these loaded onto your phone, we highly recommend at least the apps that are shown on the screen here. So I'm about to go through all of the benefits that are not changed for the upcoming plan year with Blue Cross Blue Shield, Optum, and Aetna. So they're the same great benefits that we're going to be offering with the existing IQVIA plans. The preferred PPO is still the driving medical plan. This comes with the $2,500 individual deductible or the $5,000 family deductible with a 20% coinsurance, and that out-of-pocket there to protect you, so you'll never pay more than the out-of-pocket maximum. And then the copay and coinsurance structure is not changed from last year. The prescription drug plan is also not changed, so you can still have the choice between retail or mail order. Just as a reminder, 90 days will save you money. So if you have the opportunity to order a prescription in that 90-day supply, we really highly encourage that. There are prescription drug freebies listed down at the bottom. So any diabetic supplies, including lancets, meters, lancing devices, lancets, test strips, all those items are free to you. Prescribed aspirin for adults, generic folic acid, generic prenatal vitamins for pregnancy, and prescribed generic statins if you're eligible for those. There's also an additional out-of-pocket maximum built in for the prescription drug. So if you do take a lot of drugs, we have that built in as a protection for you. The behavioral health and substance abuse benefits are remaining the same. So this is paired in with the medical plan as well. The behavioral health and substance abuse benefits are offered through Aetna. So you can seek professional counseling, psychiatric medication evaluations, ABA services for autism, and intensive services through Aetna as well. Just some open enrollment housekeeping. We just want to remind you that changes made during open enrollment are in place for the full year unless you have a qualified life event. So whatever you elect or confirm during this open enrollment period beginning next Monday are yours to keep for the plan year through March 31st, 2021. Changes made outside of open enrollment are to be made within 30 days of the life event, like having a baby or getting married. There's a 1095 tax form that will be available in your employee file. These are not required again from the government. However, if your tax person does ask you for it, we do have it safely saved in your employee file at IQVIAbenefits.org. Just a reminder that all requirements of healthcare reform are in place. And in fact, IQVIA offers more generous free wellness benefits that are required by law and all that good stuff. It's also now time to update your beneficiaries if those have changed throughout the year. That is all I have, so we can open the floor to questions if you guys have any questions. If not, thank you very much for your attention, and we hope it's another great year ahead of us. There is a copay for an MRI. The copay for MRIs must be approved as the advanced imaging. Let me see if I can go back to that slide for you. Advanced imaging must be pre-approved by your physician's office, and then MRIs are up to a $500 copay. You will not ever pay more than $500 for an MRI. Oh, it's not included on this list. You will never pay more than $500 for an MRI. So if your MRI is more than $500, the plan will pay above your copay. But if your MRI, for instance, is $200, then you'll only pay up to that $200. So it's an up to $500 copay. MRIs, though, just to note, are not subject to the deductible, so you will not be required to meet your deductible first. But just to highlight that your doctor or wherever you're getting the MRI done must seek that prior authorization. Oh, it is on the screen down at the bottom. Outpatient diagnostic imaging right here, up to $500 copay. The best phone number to call to discuss specific employee conditions. If this is related to Blue Cross Blue Shield, I would encourage you to call the Care Connected phone number, and that is 855-258-9029. If it is regarding any other issues, if it's just an ICUBA specific question, you can always call ICUBA directly. But if it is a Blue Cross Blue Shield medical question, I would encourage you to call Blue Cross Blue Shield, and the same with Optum and Aetna. If it is a prescription question, you can always call Cuba Cares. They do have access to the portal, the Optum portal, so they can view your medications and steer you in the right path. So if it is a prescription question, you can always call either Optum or Cuba Cares. And then any behavioral health questions, you can contact Aetna directly. All right, well, thank you very much for your time, and I hope you guys all have a great day. Take care.